Sounds to me like a highly qualified, very reasonable person, as we've assembled in this room.
One worry that public health officials have mentioned is, well, if we acknowledge that natural immunity is a reality, which of course it is, and it's epidemiology and immunology 101. They're worried that people would go out and deliberately get COVID rather than getting the vaccine. But of course, the issue around acknowledging natural immunity is, what about the people who already have had COVID? That's what we're talking about here, right? And we can give people advice on, avoiding infection and so forth. But ignoring all the folks that have already recovered from COVID is not a good public health policy. Acknowledging natural immunity would lead to the next very basic question: how many people have it? And the fact that 2 years into the pandemic, we still do not know exactly how many Americans have had COVID it's an astonishing failure of public health to do basic epidemiological research. The two most basic facts that every medical student learns first about every new illness that they learn about are incidence and prevalence. How many new cases and how many total cases over a given period of time, right? One very important fact about natural immunity is that there has not been a single reported case of someone getting reinfected and subsequently transmitting the virus to others, which we know is not the case for vaccines. Vaccines don't offer, against COVID, that kind of sterilizing immunity. So we FOIA'd the CDC and said, please show us any evidence of someone with natural immunity getting reinfected and transmitting the virus to others. They couldn't come up with any data. We actually put that in our lawsuit. The university's experts could not come up with a single counterexample. It's a very dangerous thing to say, right? Because almost nothing in medicine and science is 100%. You can always find outliers. But natural immunity, people with natural immunity are the safest people to be around. You're not going to get COVID from somebody who's already had COVID.
So we are seeing actually the vaccinated carry a high volume of virus because they don't have this secretory IgA. So this false construct from our federal agencies that this is a pandemic and the unvaccinated are spreading is a pathophysiological lie. The vaccinated are carrying high volumes in their nose, their tears, their mouth of virus because the vaccine does not neutralize in that location of the body where the virus comes in. So this is very important. This is why mandates are absolutely now moot, irrelevant, and out the window and need to go away worldwide like most of the world has done already.
And I just want to partner off of what Dr. McCullough said. I don't think people realize that all these people who had COVID were excluded from the trials, all of them. So we're going to take our 5 to 11-year-olds, that there's 28 million. That means 14, it was about half and half. It's probably more, 60% have had COVID already. So let's say 12 million have not had COVID. So if those 12 million had the vaccine and it was a perfect vaccine, it's 0.1 per 100,000, we might sell 12 children. What's going to happen to the 16 million children who've already had the virus, who already have immunity, and we're going to subject them to something that wasn't even tested in that group? It's literally absurd. And that's the thing I would say, Senator, is that we're not here about civil liberties and mandates. We're here to save lives. And this group of people should be excluded. Absolutely. There's an Achilles heel to the program of natural immunity. Natural immunity denial should not be happening. It should be a major focus of what we're trying to do here, because you're going to harm, I don't know how many children by force vaccinating 16 million children. It's absurd.
I'm listening to my colleagues call out all of the inanities, the insanities, the absurdities, okay, these departures of our policies from what we know are to be scientific truths. These things like denial of natural immunity. We have to understand why. To sit here and point fingers and they're doing this wrong and that wrong, why are they doing this? There could be multiple reasons. The simplest and most easily understandable and provable is every vaccine, these novel patented high-cost drugs is profits. They are putting profits ahead of patients. We can call attention to all of these policies. They are non-scientific. They're failing at having scientific support, yet they're being carrying out and they're being distributed across the country. And doctors and states and health departments are willingly accepting these without question, without critical thinking. And that's what I want us to be clear that we're calling attention to today. This is corruption. Plain and simple, it's corruption.